Question 1. A nurse is caring for a patient with left-sided heart failure. Which assessment finding is priority? A. Peripheral edema. B. Crackles in the lungs. C. Weight gain. D. Jugular vein distension. Correct answer. B. Crackles in the lungs. Rationale. Left-sided heart failure causes fluid backup into the lungs, leading to pulmonary congestion. Crackles indicate fluid in the lungs, which can quickly lead to respiratory distress. Strategy. Left side equals lungs. Always prioritize breathing over swelling. Question 2. A patient with heart failure is prescribed furosemide. Which finding indicates the medication is effective? A. Decreased heart rate. B. Increased urine output. C. Decreased respiratory rate. D. Increased blood pressure. Correct answer. B. Increased urine output. Rationale. Furosemide is a loop diuretic used to remove excess fluid. Increased urine output shows the medication is working. Strategy. Diuretics equals P equals working. Question 3. Which position is best for a patient experiencing heart failure with shortness of breath? A. Supine. B. Trendelenburg. C. High Fowler's. D. Side lying. Correct answer. C. High Fowler's. Rationale. High Fowler's helps expand lungs and reduces venous return, making breathing easier. Strategy. Heart failure plus SOB equals sit them up. Question 4. Which food should the nurse avoid giving to a patient with heart failure? A. Fresh fruit. B. Grilled chicken. C. Canned soup. D. Rice. Correct answer. C. Canned soup. Rationale. Canned soup contains high sodium, which leads to fluid retention and worsens heart failure. Strategy. Heart failure equals low sodium. Question 5. A patient with heart failure suddenly gains 3 pounds in one day. What is the nurse's priority action? A. Document the finding. B. Notify the provider. C. Restrict fluids. D. Encourage exercise. Correct answer. B. Notify the provider. Rationale. Rapid weight gain indicates fluid retention and worsening heart failure. The provider must be notified immediately. Strategy. 2 to 3 pounds in one day equals danger. Question 6. Which symptom is most common in right-sided heart failure? A. Crackles. B. Ascites. C. Dyspnea. D. Orthopnea. Correct answer. B. Ascites. Rationale. Right-sided heart failure causes fluid backup into the body, leading to ascites, edema, and JVD. Strategy. Right side equals rest of body swelling. Question 7. Which lab value should the nurse monitor in a patient receiving spironolactone? A. Sodium. B. Potassium. C. Hemoglobin. D. Calcium. Correct answer. B. Potassium. Rationale. Spironolactone is a potassium-sparing diuretic that can cause hyperkalemia. Strategy. Spironolactone equals save potassium. Question 8. Which instruction should the nurse give a patient with heart failure? A. Drink more fluids. B. Weigh yourself daily. C. Increase salt intake. D. Avoid exercise completely. Correct answer. B. Weigh yourself daily. Rationale. Daily weight helps detect fluid retention early. Strategy. Heart failure equals daily weight. Question 9. Which assessment finding indicates worsening heart failure? A. Clear lungs. B. Decreased edema. C. Weight gain. D. Increased appetite. Correct answer. C. Weight gain. Rationale. Weight gain indicates fluid retention. Strategy. Weight gain equals worsening HF. Question 10. Which medication is commonly used to reduce workload in heart failure? A. Digoxin. B. Lisinopril. C. Atropine. D. Epinephrine. Correct answer. B. Lisinopril. Rationale. ACE inhibitors reduce afterload and workload of the heart. Strategy. ACE inhibitors equals easier pumping. Question 11. Which finding indicates digoxin toxicity? A. Nausea. B. Increased appetite. C. Hypertension. D. Tachycardia. Correct answer. A. Nausea. Rationale. Early signs of digoxin toxicity include nausea, vomiting, and visual changes. Strategy. Digoxin toxicity equals GI symptoms first. Question 12. A nurse should hold digoxin if heart rate is A. 100 bpm. B. 80 bpm. C. 58 bpm. D. 90 bpm. Correct answer. C. 58 bpm. Rationale. Digoxin slows heart rate. Hold medication if HR less than 60 bpm. Strategy. Digoxin equals hold if less than 60. Question 13. Which finding indicates fluid overload? A. Weight loss. B. Dry mucous membranes. C. Crackles. D. Low BP. Correct answer. C. Crackles. Rationale. Crackles indicate fluid in lungs. Strategy. Crackles equals fluid overload. Question 14. Which diet is appropriate for heart failure? A. High sodium. B. Low sodium. C. High fat. D. High sugar. Correct answer. B. Low sodium. Rationale. Low sodium prevents fluid retention. Strategy. Heart failure equals low salt. Question 15. Which symptom indicates left-sided heart failure? A. Leg swelling. B. Ascites. C. Dyspnea. D. JVD. Correct answer. C. Dyspnea. Rationale. Left-sided heart failure leads to pulmonary congestion causing shortness of breath. Strategy. Left side equals lungs equals dyspnea. Question 16. Which symptom is most common in early heart failure? A. Weight loss. B. Fatigue. C. Cyanosis. D. Chest pain. Correct answer. B. Fatigue. Rationale. Fatigue occurs due to decreased cardiac output and reduced oxygen delivery. Strategy. Heart failure equals tired heart equals fatigue. Question 17. Which medication helps increase heart contraction in heart failure? A. Digoxin. B. Furosemide. C. Lisinopril. D. Metoprolol. Correct answer. A. Digoxin. Rationale. Digoxin increases contractility and improves cardiac output. Strategy. Digoxin equals stronger squeeze. Question 18. Which finding indicates right-sided heart failure? A. Pulmonary edema. B. Dyspnea. C. Leg edema. D. Crackles. Correct answer. C. Leg edema. Rationale. Right-sided heart failure causes peripheral edema. Strategy. Right side equals leg swelling. Question 19. Which instruction is most important for a heart failure patient taking diuretics? A. Take at bedtime. B. Take in morning. C. Take with milk. D. Double dose if missed. Correct answer. B. Take in morning. Rationale. Taking diuretics in morning prevents nighttime urination. Strategy. Diuretics equals morning dose. Question 20. Which sign indicates improving heart failure? A. Increased edema. B. Decreased weight. C. Crackles. D. Dyspnea. Correct answer. B. Decreased weight. Rationale. Decreased weight means fluid loss. Strategy. Weight down equals improving. Question 21. Which assessment finding is priority in heart failure? A. Edema. B. Lung sounds. C. Appetite. D. Skin color. Correct answer. B. Lung sounds. Rationale. Airway and breathing are priority. Strategy. ABC first. Question 22. Which medication reduces fluid overload? A. Digoxin. B. Furosemide. C. Lisinopril. D. Propranolol. Correct answer. B. Furosemide. Rationale. Furosemide removes excess fluid. Strategy. Loop diuretic equals remove fluid. Question 23. Which symptom indicates pulmonary edema? A. Dry cough. B. Pink frothy sputum. C. Constipation. D. Bradycardia. Correct answer. B. Pink frothy sputum. Rationale. Pink frothy sputum is classic sign of pulmonary edema. Strategy. Pink foam equals emergency. Question 24. Which finding suggests digoxin toxicity? A. Headache. B. Yellow vision. C. Hypertension. D. Fever. Correct answer. B. Yellow vision. Rationale. Visual disturbances indicate digoxin toxicity. Strategy. Digoxin equals yellow vision. Question 25. Which intervention helps reduce cardiac workload? A. Encourage exercise. B. Bed rest during acute phase. C. Increase fluids. D. Increase sodium. Correct answer. B. Bed rest during acute phase. Rationale. Rest reduces oxygen demand and workload. Strategy. Heart failure equals reduce workload. Question 26. Which finding indicates fluid overload? A. Weight loss. B. Edema. C. Dry skin. D. Hypotension. Correct answer. B. Edema. Rationale. Edema occurs when excess fluid accumulates in tissues. Strategy. Swelling equals fluid overload. Question 27. Which medication reduces afterload in heart failure? A. Digoxin. B. Lisinopril. C. Furosemide. D. Atropine. Correct answer. B. Lisinopril. Rationale. ACE inhibitors reduce afterload and improve heart function. Strategy. ACE inhibitors equals reduce workload. Question 28. Which symptom suggests worsening heart failure? A. Decreased weight. B. Increased urine output. C. Shortness of breath. D. Increased appetite. Correct answer. C. Shortness of breath. Rationale. Shortness of breath indicates pulmonary congestion. Strategy. SOB equals worsening HF. Question 29. Which electrolyte imbalance is common with loop diuretics? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Correct answer. B. Hypokalemia. Rationale. Loop diuretics cause potassium loss. Strategy. Loops lose potassium. Question 30. Which position improves breathing in heart failure? A. Supine. B. High Fowler's. C. Trendelenburg. D. Flat. Correct answer. B. High Fowler's. Rationale. Sitting upright improves lung expansion. Strategy. Sit them up. Question 31. Which finding indicates right-sided heart failure? A. Crackles. B. Dyspnea. C. JVD. D. Pulmonary edema. Correct answer. C. JVD. Rationale. Right-sided heart failure causes jugular vein distension. Strategy. Right side equals neck vein swelling. Question 32. Which instruction should the nurse give? A. Increase salt intake. B. Monitor daily weight. C. Avoid medications. D. Drink more fluids. Correct answer. B. Monitor daily weight. Rationale. Daily weight detects fluid retention early. Strategy. Daily weight equals HF rule. Question 33. Which medication increases cardiac output? A. Digoxin. B. Lisinopril. C. Furosemide. D. Aspirin. Correct answer. A. Digoxin. Rationale. Digoxin improves cardiac output. Strategy. Digoxin equals stronger pump. Question 34. Which sign indicates pulmonary congestion? A. Leg pain. B. Crackles. C. Dry skin. D. Constipation. Correct answer. B. Crackles. Rationale. Crackles indicate fluid in lungs. Strategy. Crackles equals fluid. Question 35. Which diet is recommended? A. High sodium. B. Low sodium. C. High fat. D. High sugar. Correct answer. B. Low sodium. Rationale. Low sodium prevents fluid retention. Strategy. Less salt equals less fluid. Question 36. Which sign indicates improvement? A. Increased edema. B. Decreased weight. C. Dyspnea. D. Crackles. Correct answer. B. Decreased weight. Rationale. Weight loss indicates fluid reduction. Strategy. Weight down equals improvement. Question 37. Which symptom is common in left-sided heart failure? A. Leg edema. B. Ascites. C. Dyspnea. D. JVD. Correct answer. C. Dyspnea. Rationale. Left-sided heart failure causes pulmonary congestion. Strategy. Left equals lungs. Question 38. Which medication removes excess fluid? A. Digoxin. B. Furosemide. C. Lisinopril. D. Metoprolol. Correct answer. B. Furosemide. Rationale. Furosemide is a loop diuretic. Strategy. Furosemide equals fluid removal. Question 39. Which symptom indicates severe heart failure? A. Fatigue. B. Pink frothy sputum. C. Mild edema. D. Dry cough. Correct answer. B. Pink frothy sputum. Rationale. Pink frothy sputum indicates pulmonary edema. Strategy. Pink foam equals emergency. Question 40. Which intervention is priority? A. Encourage fluids. B. Monitor lung sounds. C. Increase sodium. D. Encourage exercise. Correct answer. B. Monitor lung sounds. Rationale. Monitoring breathing is priority. Strategy. Airway first. Question 41. Which sign indicates decreased cardiac output? A. Warm skin. B. Fatigue. C. Hypertension. D. Bounding pulse. Correct answer. B. Fatigue. Rationale. Decreased cardiac output reduces oxygen supply causing fatigue and weakness. Strategy. Low output equals tired patient. Question 42. Which finding suggests fluid retention? A. Dry mouth. B. Weight gain. C. Weight loss. D. Hypotension. Correct answer. B. Weight gain. Rationale. Weight gain indicates fluid accumulation. Strategy. Weight up equals fluid. Question 43. Which medication decreases heart rate and workload? A. Metoprolol. B. Digoxin. C. Furosemide. D. Dopamine. Correct answer. A. Metoprolol. Rationale. Beta blockers slow heart rate and reduce workload. Strategy. Beta blockers equals slow heart. Question 44. Which assessment finding indicates right-sided heart failure? A. Pulmonary edema. B. Ascites. C. Dyspnea. D. Crackles. Correct answer. B. Ascites. Rationale. Right-sided heart failure causes fluid accumulation in abdomen. Strategy. Right side equals body swelling. Question 45. Which intervention reduces fluid overload? A. Increase fluids. B. Restrict sodium. C. Encourage salty foods. D. Increase fluids. Correct answer. B. Restrict sodium. Rationale. Sodium restriction reduces fluid retention. Strategy. Less salt equals less fluid. Question 46. Which symptom indicates left-sided heart failure? A. Leg edema. B. JVD. C. Crackles. D. Ascites. Correct answer. C. Crackles. Rationale. Left-sided heart failure leads to pulmonary congestion. Strategy. Left side equals lungs. Question 47. Which finding requires immediate intervention? A. Mild fatigue. B. Pink frothy sputum. C. Mild edema. D. Weight gain 1 pound. Correct answer. B. Pink frothy sputum. Rationale. Indicates pulmonary edema, a medical emergency. Strategy. Pink foam equals emergency. Question 48. Which instruction should be given? A. Weigh weekly. B. Weigh daily. C. Avoid medications. D. Increase salt intake. Correct answer. B. Weigh daily. Rationale. Daily weight detects worsening early. Strategy. Daily weight equals HF rule. Question 49. Which medication improves cardiac contractility? A. Digoxin. B. Lisinopril. C. Furosemide. D. Metoprolol. Correct answer. A. Digoxin. Rationale. Digoxin increases contractility. Strategy. Digoxin equals stronger pump. Question 50. Which sign indicates worsening heart failure? A. Decreased edema. B. Increased urine output. C. Dyspnea at rest. D. Weight loss. Correct answer. C. Dyspnea at rest. Rationale. Dyspnea at rest indicates severe heart failure. Strategy. SOB at rest equals severe HF.